Greetings, my name is Rebecca Colon. I am a student from the University of Puerto Rico campus Mayagüez from Professor Sandra Rios' English class. Throughout this presentation, I'll be talking about what happens to pedophilic child molesters in the island of Puerto Rico. Throughout this presentation, I'll be talking about what is pedophilic molestation, causes reported in the island of Puerto Rico, and how these cases are taken care of. Also, how pedophilic child molestation is some sort of taboo in this island. So what exactly is pedophilia? Pedophilia is defined as some sort of sexual orientation, an attraction that cannot change towards children, as said by Dr. James Cantor. Furthermore, a pedophile is someone who has a sustained sexual attraction towards children, ages 13 and under. In Puerto Rico, there are approximately 2,000 cases a year of child molestation. The charges taken upon them are years of jail time, up to 20 years, and a variety of therapy. Although not all pedophiles act upon their desires and fantasies, the ones that do need to be punished for their crime. For there is no cure for pedophilia, but there are endless types of treatment, such as hormonal treatment, chemical castration, therapy, among others. In order to decide which treatment is most effective, many evaluations and investigations need to be effectuated. Many treatments have been created, and all of them have had their victories and defects. The proposal aims to find the most appropriate solution to minimize and end child molestation. According to Registro de Personas Convictas por Delitos Sexuales y Abuso contra Menores, there are currently more than 3,000 child molesters in Puerto Rico. As it can be observed in the chart, there are a significant more percentage of male sex offenders in the island. This fact will be relevant in the range of treatments for molesters later on discussed in the presentation. Deciding which is the most appropriate treatment for a pedophile is not an easy task. In order to decide which treatment is most effective, many evaluations and investigations need to be taken care of. Types of treatment. A. Hormonal treatment. Doctors introduced oral hormonal treatments via estrogen pills to lower the molester's sexual drive. This treatment appears to be more effective for some offenders and people who have unwanted urges. B. Therapy. Therapy integrates psychological, sexological, as well as pharmaceutical approaches. Therapeutic points of entry are oriented towards spheres of life that researchers have identified as decisive for the prevention of further sexual offenses. C. Chemical castration. This treatment reduces the sex drive and migrates deviant desires. While the feelings remain, they are less obsessive via drugs. D. Castration. While ureectomy, the surgical removal of the testes, may lower male testosterone levels and decrease sex drive, the procedure won't change the object of a pedophile's desire, children, as said a psychologist who evaluated 3 castrated inmates from Texas. The chosen solution for pedophilic child molesters. The solution and treatment I found most effective or appropriate was chemical castration. Remember, this was the treatment that uses drugs to lower testosterone count, then by lowering sexual desires on child molesters. It's more effective on men because they have a higher testosterone count, but women also have like a small amount of testosterone. Then by lowering it more, it lowers their sex drive. Drugs that are typically used to chemically castrate are Lupron and Depo-Provera. Lupron is a drug typically used to treat symptoms of prostate cancer on men and endometriosis in women by lowering the amount of testosterone and estrogen production, respectively. This drug is used to treat child molesters in general by lowering their testosterone count, then by lowering their sex desires. There was a study made by MD Justin Scober to see the effect of Lupron on 5 pedophilic white men between the ages of 36 and 58 for a course of 2 years. The subjects were measured every 3 months for their pedophilic desires, and a significant decrease was observed. Concluding that this investigation proved to have worked and that pedophilic behavior can be modified, these subjects were injected with Lupron weekly, and they used a needle to inject this drug. As you can see in figure D and E, that there's a little case with the drug and the needle. The other drug is Depo-Provera. This drug is used to reduce male testosterone levels, consequently a reduction in sexual interest and activity. A study done by MD Theodore Skirch tested the effectiveness of this drug on child molesters. The subjects of this investigation were under the age of 40 and were injected with the drug weekly, and these also reported any type of fantasy or desire. The investigator concluded that it did decrease sexual drive, although it did not cause disinterest in children. The drug did decrease deviant fantasies. Legality of chemical castration is very controversial internationally, as stated in CNN News report done in 2012. The Department of Justice of Puerto Rico proposed comments on Ley Número 149 from June 18, 2004, to be reevaluated and to protect the victims of pedophilic child abuse. But the comments were helpless and nothing was approved, although in the U.S. they have approved and legalized chemical castration in some states. This is relevant that in the U.S. They have approved and legalized because we do belong to the U.S. The importance of pedophilic child molesters. Victims of child molestation in the long run are traumatized by their attack and their attacker. Since this topic is some sort of taboo because victims usually don't come out with their secret, it doesn't have the awareness it deserves. Long-term effects of child molestation victims include guilt, shame, self-esteem issues, substance abuse, depression, among other things. You can see in figure F of this slide how this girl has a lot of hands on her, and she's holding a little plush toy, and you can see actually that is essentially is someone grabbing her and harassing that little girl, and how the little girl's innocence is taken away and she can't do anything because she doesn't know what's happening to her. And that happens to pedophilic child molestation victims. In figure D, it says to ensure that children are protected, the abuse and exploitation of children must be brought to light, and those who violate children brought to justice. I find this quote really important because this topic does need it to be brought to light because it's so important and it happens a lot. There's thousands of cases a year and there's thousands of molesters, as mentioned previously. And this needs to be brought to light. These people need to pay for their crime and need to be treated. And these children the victims need to be treated for their attack because they are traumatized. And figure H, it shows a little girl, and in the lower part of the picture, it shows that there's a man touching her. And it shows that you may think it doesn't happen because you don't see it. But in the dark, it does happen. It does need to be brought to light, as it says in figure G. And I just think that it's a very important topic. It needs to be talked about more. Victims need to be brought to justice and should be at peace with what happened to them. To conclude this presentation, pedophilia is a very serious topic and it should be taken seriously. Although there are a lot of registered molesters, not all of them are reported due to the victims being scared of people finding out and being teased or brought down because they were attacked. Victims of molestation may suffer from depression or anxiety and live a very disturbed life. There are many treatments and solutions for pedophilic child molesters, although there is no cure. The purpose of the presentation is to show insight on how this is being faced in the island of Puerto Rico and how it really affects its victims. I find that, as I said previously, it's very important and needs to be brought to light, and it's something that people need to know more about. I personally didn't know much about the topic. I just knew that it's someone that attacked children, and I really wanted to see how it was treated in the island and how it needs to be brought to light and how it's treated and the treatments that exist for it and so on. In the next slides, you will see the works cited that I used for my presentation. There you can find all the investigations, all the definitions, all the facts that I stated throughout the presentation. And finally, you can see the appendix of all the references and works cited of the images that I used throughout the presentation. And if you want to go back in the presentation, you can see that in the third slide, figure A, it says that 1 out of 6 children are sexually abused and 75% don't tell. You can really see how victims really are terrified and scared to show what really happened to them and what crime that they were attacked and their abuser, how they got away with it, just because they're scared to tell someone. And another figure C, in slide 5, it says, most victims of child abuse can't ask for help. You can. And it shows it makes you think about it and say like, wow, I can make a change. And that's another purpose and of the presentation, to bring light and share with people and talk about it, because it's very important to talk about child abuse. I really hope you enjoyed the presentation and that you could take something, just a little bit of what is pedophilia and how child molestation is faced in the island of Puerto Rico. Thank you and have a nice day.